Has your dog recently been diagnosed with arthritis? Do you know how to manage it? So let's talk about arthritis. Hi, I'm Dr. Ginette with the Holistic Chiropractic Wellness Center. I'm a certified animal chiropractor, and I often see dogs who are senior and have been recently diagnosed with arthritis. So very often clients are worried or concerned. How do you manage it? What can you do? Sometimes they've already come from the vet, very often with radiographs. So x-rays were taken of the spine or hips, and there's signs of deterioration, or also known as osteoarthritis. So arthritis, the word itis means inflammation. Arthritis means inflammation of the joint. So it's not a reason to panic if your dog's been diagnosed with arthritis, but you need to you need to figure out how are we going to manage this condition, because you can't reverse any damage that's done to the joint, but that joint may flare up periodically and can cause issues such as mobility issues, pain, and they may show signs in behavior where they don't want to go for long walks anymore. They might have a hard time getting up into the car. They may, when they get up from a lying position or a sitting position, kind of work things out and be a little bit more stiff until things loosen up, and then they work it out. So from a chiropractic perspective, I help a lot of dogs who are seniors, and very often what I notice is these joints are stiffer. So we're looking for mobility in that joint. That joint is stiffer, it doesn't move as well as the tissues around it. So muscles and ligaments will be tighter as well, because they're trying to contract and really support that joint. But you don't want too much stiffness or immobility, because that joint becomes stiffer over time and will deteriorate more quickly. And as well, it doesn't feel good to have tight joints and tight muscles. So adjustments and gentle mobilizations to those joints will bring better movement to the joints, where we improve the flexibility, the mobility of that joint. It improves with pain management, so it's a natural way to decrease pain coming from that area. And will really improve the quality of their life. So very often clients will tell me after we've done an adjustment or even two that their dog is moving better. The dog actually is working that stiffness out a little faster when they get up from a lying position or seated position, that they're able to trot more easily, go on a longer walk. They're able to get in and out of the car or jump up onto stairs or into a bed more easily. I actually had a dog who had come to see me, and going from the house to the car, the dog, almost like an old man, would have to sit multiple times to take a rest because of the pain and the lack of mobility, and the different, what we call lack of neurological input. After that first adjustment, the dog ended up going home, getting from the car, went straight to the house without stopping, which that is amazing, but then got into the house and wanted to continue and go play out in the yard. And the owner was just shocked on how well there was such a quick response and change in that dog. And so I just can't tell you how often I hear wonderful feedback from owners when we start adjusting dogs who are senior. And it's really just amazing how well their spine and nervous system can adapt and can improve with chiropractic adjustments. Another thing that's really helpful with arthritis is your dog needs to have a really healthy weight. So if there's any excess body weight, that joint has to support more weight, whether it be on the knees, the hips, or the spine. So a healthy weight is critical if your dog has arthritis. Another thing is you want to be careful on activity. So you want to have some movement, but not too much. So you want to limit really quick sprinting and repetitive movements, such as ball throwing or frisbee or chasing rabbits in the yard, where there's quick bursts of movements and it's repetitively done over time. What I do recommend is doing short, low impact activities, such as walking. And at the beginning, you may have to take back that activity. And if normally your dog was able to do, let's say, 45-minute walk, if the dog is showing any signs of slowing down where they're starting to sniff more, or you have to coax them to get going and continue to follow you on the walk, or they're starting to limp or really show signs of slowing or pain, you've gone too far. So instead of doing a 145-minute walk, I would recommend doing a short minute walk and doing it twice. So that might be 5 or 10 minutes and doing it twice, or maybe a 20-minute walk, but it really depends on what your dog's ability is. And so if you're not sure, then talk to your healthcare provider so we can just figure out what the best time is for that dog. But sitting in the house without any activity is actually the worst thing as well. So just like humans, we need some movement. So life is just about movement. So doing some gentle walks would be really helpful with arthritis. The other thing that you can look at is your dog's diet. Now there's certain supplements and specific diets that might be helpful to decrease inflammation, and that's something that you're going to want to talk to your veterinarian or your healthcare provider that's helping you with your dog. There's also some core exercises that can be helpful. So we actually want to strengthen a joint that is arthritic. So the better that joint can be strong and be supported, the better it will do, whether it be, like I said, the spine, the hip, or the carpus, for example. So hope that's helpful. If you have questions about how to help your dog with arthritis and other things that you might do for their specific condition, then talk it over with your healthcare provider so that your dog can really just have the best quality of life possible.